So very briefly, sort of the population we're talking about. We focus mainly on the temporary labor migrants, but there are obviously many other types of migrants going from China to Africa. But this is a significant group that is increasing. We see mainly two types of migrants. One is the group that is contracted through Chinese-based projects overseas, mainly in Africa. And then the other one is they're recruited individually through recruitment agencies or through informal networks. I will talk to you a bit more about specifically migrants in Africa. We see, for instance, that of the top 10 countries of trading partners of contracted projects of China, that the four, Algeria, Nigeria, Sudan and Angola, are in the top 10. So we see increasing number of Chinese projects in Africa, which has an implication for the group of migrants that are coming along to these projects, that are mainly young males working in semi-skilled and low-skilled, mainly construction, mineral and mining sectors. Just to give you an overview, this is from the African Development Bank, just to see the increase in trade between China and Africa. The red line represents the exports to Africa, and the sort of brownish green Africa exports to China. You see the main countries in Africa that are trading partners. Now, some other types of migrants, aside from the Chinese project migrants, we see also small-scale entrepreneurs, including moving to Africa, trading in Chinese goods, starting restaurants and traditional medicine. Often these entrepreneurs start around Chinese projects, doing some kind of support services to these projects. Another group is of migrants that go to Africa. They see it as a stepping stone to go to Europe and North America. Another trend, which is interesting, I think, is a group are Chinese farmers starting farms in a number of African countries. And I think it was already indicated by some of the colleagues that the main provinces of origin in China are Guangdong, Fujian, and Zhejiang. I hope I pronounced that okay. I'm sure I didn't. But increasingly, we see other places of origin emerging. So it's quite a dynamic process. Now, in terms of the international migrants from China to Africa, what are some of the health vulnerabilities? Generally, we can say there's very limited research done on health on Chinese people in Africa. Some small-scale studies, especially on HIV, as obviously HIV is a huge factor of the burden of disease in sub-Saharan Africa. From the small studies we see, generally, as the group is mainly single young adult males, we do see risky health behavior, including unprotected sex and lack of accurate knowledge on STIs and HIV transmission. And obviously, in the context of sub-Saharan Africa, this is a risk. We also see that obviously migration stressors are sort of being apart from your family, maybe doing high stress work can lead to increasing levels of communicable diseases as well as non-communicable diseases, where we see, for instance, issues around alcohol abuse or substance abuse. Obviously, understandably, Chinese migrants in Africa, there will be barriers to access the local health systems in terms of culture and also language. Interestingly enough, we see more and more also traditional Chinese medicine practitioners coming to Africa. And this is usually the preferred choice. So this could be also a policy intervention, perhaps as an entry point. Now, in terms of health policies for this group, there's no specific health-specific policies for Chinese labor migrants. It's usually the health-related issues are integrated in the labor migration policies. One such policy is that Chinese migrants working overseas for more than a year should have a valid health certificate, including a result of an HIV test. If this is enforced, I'm not sure. But it is a policy. Another policy is that intermediary agencies, including Chinese business projects, should pay for social insurance as well as pre-departure training, including on issues around occupational hazards and safety. Again, We don't know exactly how much information, specific health-related promotion content there is in these pre-departure trainings and if these are happening on a regular basis. Also, the research shows that the implementation of these different policies depending on the local sending authority within China, within the different provinces. The second group that we looked at in this paper was international migration to China. We looked at two groups. The first one is mainly from the Greater Mekong sub-region, entering and working in China and southwest part of China. These were our regular migrants, but also quite a lot of temporary irregular migrants, including cross-border traders, commercial sex workers, also marriage migrants, victims of trafficking and smuggling, etc. Mainly working in the lower skilled sectors, such as manufacturing and agriculture. And obviously the migration factors, the push factors, if you will, are the economic disparities, increased cross-border trades, and the improved transportation structure, as well as the vast and porous land borders. The second group that this paper looked at are the African migrants, mainly in Guangdong province. These groups are either businessmen, more longer-term, regular businessmen living in China for longer periods of time, or what we call transient traders who come to China to buy products and then go back to Africa to sell. Vast majority single males, approximately 30 years old. And there is some evidence of growing numbers of African sex workers in China. So these are sort of the two main groups that we looked at in this paper going to China. Now, in terms of health policies, health vulnerabilities, again, sort of an overarching issue that will affect sort of how migrants feel in the country is that the immigration law indicates that foreigners with serious mental illness and infectious diseases that constitute a major threat to public health are barred from entry. So you can imagine that this will affect also health-seeking behavior and especially accessing health services. What we see from the migrants from the Greater Mekong region is that some provinces have experienced localized HIV epidemics due to the increased trend of men from poor areas buying their wives from the GMS countries, going back to their regions. We also see quite some higher rates of HIV and high-risk behavior amongst the intravenous drug users and commercial sex workers from Myanmar, Vietnam, compared to the Chinese. And then co-infection, as was already mentioned, with hepatitis C and B is also reported amongst IDUs in the China-Myanmar border region. And also TB and increasingly malaria has been coming up in the region. Now, the health concerns regarding the African migrants, mainly in Guangdong, we see mainly the three health concerns are the lack of ART treatment for migrants living with HIV, limited access to healthcare services. Again, you'll see the same around language and culture barriers as well as administrative barriers. And mental health conditions, generally uncertain migration status, fear of deportation, also related to some of the laws. So we see a lot of self-medication and over-the-country sort of out-of-pocket payments for these migrants. Now, what are the knowledge gaps? Quite similar for the two types, both the Chinese migrants in the African region as well as the migrants of the migrants in China. We see just what the evidence says so far seems to be quite anecdotal and not longitudinal and not very detailed. But yeah, we don't know enough about the disease. We don't know about their health knowledge, their access to services, some of the patterns. Why are migrants accessing or not accessing services? We don't know a lot about the health impacts on communities of origin, and this, as was shown by my colleagues earlier, sort of the going through the migration cycle, what does that mean for the communities of origin and bringing back some of the communicable diseases? Also, what I think is what the paper showed is a knowledge gap is that there seem to be health policies in place, but there's very little information about if these are implemented or enforced. And I think then specifically looking at the issue of the Greater Mekong region, the whole issue around marriage migrants seems to be an area where there's a lot of knowledge gaps. Now, key policy challenges, I guess, quite similar for the immigration. I think there's a really no provisions on and guidelines on specific health components for outgoing migrants. I think there's a real policy challenge that, as was shown in the pre-departure phase, there's a real opportunity for pre-departure, maybe health assessments or pre-departure health promotion. As I said, there seem to be limited compliance mechanisms for Chinese intermediary agencies. They should provide some social protection, but it's not clear if this is happening. And then on the immigration side, most problems obviously, as always, deal with irregular migration. For instance, with this law about irregular migrants with serious health conditions should not be detained. Is this happening or not? There's no clear instructions on what to do with irregular migrants with health condition in terms of referral. The few responses that are there seem to be more targeted at the higher skilled migrants, like from Korea or Japan. Then specifically around HIV and for IDUs, there's access to methadone and ART require national identity card. So this obviously makes it difficult for migrants, especially irregular migrants, to access ART services. Now, in terms of lessons learned, what is quite nice in both the presentations is that I think our assessment is quite similar. As IOM, we always promote sort of the global framework that has been approved and by the WHO member states, which is the World Health Assembly resolution of 2008, and how we try to work with partners in the field and governments to make sure that a migration health in every agenda in every country should look at 4 pillars. One is the monitoring, so make sure that you know what the situation is in terms of data. You have to strengthen your policy and legal frameworks, your networks and partnerships. But intersectoral, very important, because with migration, you don't just deal with the health sector, you also deal with the migration sector, with the labor sector, with education, with foreign affairs. Very little of this intersectoral collaboration is happening. As well as with civil societies and cross-border. And then lastly, strengthen migration-sensitive health services to make sure that with increased diversity, migrants have access to your health services. And I think this is not typical Chinese problem. You see these kind of findings of the paper are very similar for other countries as well, is that generally people are not, the health systems are not responding to the needs of migrants or to migration pressures. Yeah, and then lastly, as we say, addressing migration-related health challenges is in line with migrants' right to health. It improves public health outcomes, and it has positive development outcomes for all, both the host communities as well as migrants. And as was already identified earlier, is that health responses should really happen in all phases of the migration process. It's a continuity of care approach. And there are very good examples around the world of what kind of interventions can happen in the place of origin, transit, destination, and return. And I think perhaps some dialogue between different countries in Asia or with China would be an interesting next step. So this is very briefly some of the basic findings. Thank you.